So I'm Amy Chesterton. I'm a clinical pharmacist and I work within the Central PCN. I work across 2 GP practices and I support GPs and our patients within the practice. I help with clinical queries from GPs and dealing with patient queries about their prescriptions or drugs and their treatments. Supervision's been brilliant for me. I came from a completely different role previously to doing this job, and it's helped support me with decision making, learning loads of new things, delving a bit more into my clinical knowledge and expanding my knowledge, and it's really nice to have the support of someone that helps you and trusts you. I think just knowing that I have someone there that I can go to with stuff I'm not sure on, or stuff I even just want to develop my knowledge on, maybe looking down different avenues and considering different options when making a decision, and just having someone with a lot more experience in different areas has been really helpful. I don't think I've not come across anything that hasn't worked as well. I found it just overall very, very useful, and it's not something that I'm sure everybody benefits from, but it has really benefited me. Yeah, so I think it's just really important as a clinical supervisor to be able to just give your time and a little bit of support to us. We really always appreciate it, and it really helps us develop us within our role. I've certainly experienced a massive jump in my clinical knowledge and learning things I would never have learned if I hadn't worked in this role, and that has come from having a clinical supervisor. Also, I guess I really needed a clinical supervisor right at the beginning, having regular check-ins and reviews of some different situations, sometimes on a daily basis, and as time has gone on, that's decreased. So it's not, I guess it's not something that's always needed, but it's helpful to have that. And then I guess, as an example, I had a patient yesterday who was quite a tricky patient who doesn't necessarily always engage with the practice very well. This patient was on high-risk medications, and I guess I just needed some advice and support on how we then take that patient forward with getting him to come into the practice and engage with him, and what different things we need to put in place for that patient.